Hello there. Today we'll discuss about paranoia. Paranoia is not very uncommon. You must have seen it in movies, read about it in novels. If you read dictionaries, you will find specific words like extreme mistrust and suspicion. They are the key features of paranoia. Along with that, you'll find they mention that it's often unreasonable and quite out of ordinary. These are the defining things about paranoia. Paranoia is a condition when one thinks that people around him who are related to him or in a position to influence him are out there to harm him. So the people could be from his office colleagues, friends, relatives, neighbors, and the harm can be to that particular person or the other persons who are near and dear to him. Like sometimes people say, Doctor, these set of people are out there not just to harm me, but my children. The harm can be physical, like injury or killing someone. It can be financial, like siphoning out all the savings from the bank. It can be social, tarnishing one's image in the office or ridiculing in a public place. It can also be emotional, like influencing my children in such a way that they're not going to love me anymore. So it can have many dimensions. Also, the harm can be done directly, as the people who are suffering from paranoia would describe. The harm can be affected directly or indirectly, sending someone else to harm me. Overtly, very clearly, or covertly. It can be immediate, it can be gradual. So it can be of different forms and types, can come in different situations. If we try to learn or understand about paranoia, we'll find out, and in many popular textbooks or dictionaries, they'll mention that it's quite common in mental illnesses. For example, there's a sign or a characteristic feature called delusion of persecution. A delusion is a false belief which is held firmly against logic. And if that false belief pertains to someone's trying to harm me or a group of people is trying to harm me, that becomes delusion of persecution. This is quite common in mood disorders like bipolar disorder, in schizophrenia, also in people who are addicted to drugs or alcohol, and of course in some forms of personality disorder. So let's discuss some of them. We know about mood disorders, we know about schizophrenia, but about personality disorder, let's have some words about it. Personality is what defines us. If you try to describe a picture, we'll describe a lot many things about the picture. What is it showing? What are the colors? What is the texture of the material? Everything about it. Like a person, if you describe a person, there would be choices made by the person. What is his mood like? Who does he go along with? What are his choices, prejudices, habits? All sorts of features make the character of a person. If something is in the form of aberration in any of these things, the mood, the choices he or she makes, the prejudices, that can lead to personality disorders. There are some personality disorders where paranoia is very common. So if paranoia is part of a mental illness, of course we'll need professional help, psychiatrists, clinical psychologists, mental health workers, and so on. But the important question is, can paranoia happen in common people? Well, in 1970s, mid-70s, Golda Meir, the Israeli Prime Minister, famously said, even paranoids have enemies. And there's a famous book written by Joseph Burke and colleagues in the same name, Even Paranoids Have Enemies. The feeling of paranoia takes shape out of many complex emotions. And You'll agree with me when I say that in common people, paranoia can be seen in the situations of stress. Imagine a person who have to finish a project under deadline and his promotion is dependent on it. He might have paranoid feelings that my colleagues are not cooperating with me. A very good student, suddenly there's an advancement of the exam date. He might have paranoia. In the condition of sleep deprivation, if it goes on for quite some time, days on end, paranoia can come in. And of course, under the influence of alcohol or drugs, paranoia is seen. Apart from that, if paranoia is there, what else do we need to know? One good question would be, should I be worried about it? Yes, you should be worried about your paranoid feelings if it's prolonged, staying too long, or it's coming back. Every stressful situation you're feeling in the same way. And if you see that there's paranoia and you cannot pinpoint a specific reason for it, then it's a good idea to talk about it. But then whom to talk about it with? First, find people you trust. Talk with them. Let's get their ideas. What do they feel about it? Are they agreeing with me, or are they trying to explain why I'm feeling it? Next would be, try to find the antecedent. What happened after which I've been feeling paranoia? What exactly happened? Is there any perpetuating factor, any factor which is prolonging it, like alcohol or sleep deprivation? And if there's no reason, and your near and dear ones agree that there's no discernible reason, it's always better to talk to a professional person. So this is about paranoia. There are many things to read about it. It's quite common. It's seen among common people as well. But there are situations when you should seek professional help about it. Thanks for watching.